Our viewer Valerie just went on a gluten-free diet, and she's a little concerned because some people and things she's read say gluten-free is not really gluten-free in a store. How do you deal with that?
Well, unfortunately, there are no labeling laws that require a specific definition of gluten on a gluten label. It's widely accepted that wheat, barley, rye, and oats are the grains that contain gluten, but there's a lot of new research coming out about other grains and the glutens in those other grains creating problems for those with gluten sensitivity, which makes that gluten-free aisle really, really tough to navigate.
So what do you do, and how do you know what is a good and healthy thing for you to eat?
Well, I think the first question that you have to ask is the golden rule of nutrition, which is if it's good for me, then I can eat it, right? So is it good for you is the first question that you want to ask. Second question you want to ask is, am I allergic or intolerant to this food? And the third question you want to ask is, if it makes me feel bad, I shouldn't continue to eat it, obviously. But with gluten, where gluten is concerned, I think we have to look at a lot of these gluten-free foods as whether or not they're healthy, not even necessarily whether or not they're gluten-free, but whether or not they're healthy in general. Most of these are highly processed, genetically modified, loaded with sugar, way overweighted in carbohydrate calories, and so they're going to create problems in different ways that aren't related to gluten for these patients who are trying to go gluten-free initially.
But when you see these aisles, they go on forever and ever. But is there anything on those aisles that would be considered healthy for these patients?
I'm sure there are a few things that you could find. There are exceptions to every rule, and I think following a couple of easy guidelines are important. Number one, always read the ingredients. And if a food has a label, or if a label has a list of ingredients, I like to look at the simple rule, which is if there are more than 5 terms, if there are any of those terms that you can't pronounce without a biochemistry degree or with a lot of practice, then that would probably be something best left avoided.
And again, just be careful and maybe go on the outer outskirts. We always hear that of the grocery store. So you're talking fruits, vegetables, and meats. Go back to sort of what the cavemen used to eat.
That's right. There's no food like real food. Plant-based foods and meat-based foods are real food. When we start looking at foods that are highly processed and highly packaged, they're not good for us anyway. And if the whole point of going gluten-free is to restore health, how can we do so if we just trade gluten-free foods for foods that are chemically loaded, for foods that are not healthy for us? It's going to be a hard road to recovery if we do that.
Well, it sounds like it's good guidelines for everybody to follow on any aisle of the grocery store.
Yeah, absolutely. Common sense is common sense.
Thanks, Dr. Osborne.
You're welcome.
If you have a question to ask the doctor, you can find me on Twitter or Facebook. Just like my Facebook fan page, and then you can post your comments.